So it only took me 2 years to do my second video, but I got ill after the first one, so I'm back. The first one was called The Cult of Trauma, where I gave an overview of the concept creep around the word trauma as it's used in psychology and counseling and therapy today, and why I think it's a problem. It's fragilizing the youth in particular, and one of the main proponents of that, the main influencer I would say, is a doctor called Gabor Maté. Back then, 2 years ago, he had kind of become infamous overnight, really, after he did what could only be described as an ill-advised impromptu therapy session with Prince Harry, of all people. And there was a Guardian article that came out shortly after it, talking to him and discussing his reaction to getting called out by the press for that. And at the time he was flogging a new book, that's why he was on the TV. That book was called, what was it? The Myth of Normal. Trauma, Illness and Healing in a Toxic Culture. So no bias there. And yeah, it was a complete debacle, that interview with Prince Harry, because he had diagnosed him on the spot, as it were, with PTSD or trauma, as he prefers to call it, ADHD, panic disorder, depression, substance abuse. And if that sounds like typical psychologist behavior, well, yes, but Maté's in a completely different league, really. He doesn't just dish out diagnoses like they're candy. He kind of invents them, right? And this concept of a watered down concept of trauma as the cause of almost everything is his shtick. That's what he does. So he's gained a kind of huge following over the last 10 to 20 years, and it all started in 2008 with the publication of his most famous book, which was called Hungry Ghosts, which was a sort of grungy yet syrupy tome with biographies of his patients, his injection drug using patients in Vancouver. And I mean, all credit to him for working on the front line in Hastings, I think it is, in Vancouver. He ran I think probably the methadone clinic there. And yeah, all credit to him for that. That's tough work. I've done similar work and in northeast London, and I know that world, and thanks to him for that. But it was the problems really started when he published this book, because it became a kind of virtual Bible in the bizarre parallel universe inhabited by psychotherapists, right? And it promoted the idea that childhood trauma is really the only main cause of addiction. I mean, never mind that addiction rates in trendy enclaves of Western cities like Vancouver and London dwarf those of Sub-Saharan Africa and South Asia and so on. These are just inconvenient facts. I mean, you would have thought it's kind of absurd on its face, really, the whole theory, and it is hugely influential now. So I feel, even though I don't particularly want to make any personal attacks on Gabor, I feel somebody needs to call it out, right? So I'm going to go back to this article because it's the best example of why this whole theory is so self-indulgent, wrong, and causing harm, right? So this rather credulous Guardian reporter was describing him as a trauma doctor. Obviously, there's no such thing, really. He's actually a GP, a family doctor, although one who does have a lot of experience with addicts, to be fair. But what he really is a trauma evangelist. And he's garnered, as I said, this almost cult-like following amongst the worried well, I would say. He's the kind of chief rabble-rouser, I would say, of a movement that, at large in healthcare, and in particular mental health care, that combines Marxist rhetoric with psychoanalytic mumbo-jumbo. That's how I'm going to frame it. And this movement, as I said, sees trauma as the root cause of everything, really, from addiction to autoimmune disease, cancer even. He's famous for saying things like, I've got a quote here, where is it? Trauma is multi-generational. We pass on to our offspring what we haven't resolved in ourselves. That's a sort of typical thing that he would say. I mean, and he means biologically, you know. So quite how that works is currently a mystery to most scientists, you know, but he has no problem spouting ideas like that. The idea that trauma is biologically passed on. No, trauma can be passed on by talking about previous generations' traumatic experiences. You know, they used to beat us up, they oppressed us, this such and such happened in 1930, and the new generation learns about traumatic experiences, and perhaps to some extent still suffers the fallout or effects of that. But the idea that it's passed on genetically is spurious, to say the least. But this reporter seems to gobble all of that up, as so many millions of people do now as a result of his massive PR campaign around it. It's absolutely rife and endemic, not only in counselling and psychotherapy, also in the addiction treatment centre world where I work, in education, in government, as I will explore in some follow-up videos. So this word trauma has undergone a kind of radical transformation over the last decade in particular, but over the last 20 years really, thanks in no small part to this kind of Freudian reformation that Maté has subjected us to. It's a case of concept creep. So that idea was coined by Nick Haslam, who's an Australian academic, meaning obviously that you can have an idea that might be pretty good or even true, and it just gets bigger and crazier and it gets misapplied. Well, trauma in the sense that psychotherapists mean it today is such a case in point. It is the greatest case of concept creep that you will ever see. It's seriously out of control. So the word used to mean, obviously, grievous injuries originally, you know, like a gunshot wound to the head or something. You know, you rock up at ER with a gunshot wound, that's trauma. Post-traumatic stress disorder, PTSD, which is one of the most well operationalized disorders in all of psychiatry. That developed over decades from the First World War, when we realized there was a thing called shock trauma, or shell shock, through the Second World War, Korean War, Vietnam War, and finally psychiatrists classified it, and it's a very useful diagnosis. So we already have a definition of trauma that's pretty damn good and reliable almost all of the time. So it does rather invite the question, why have they invented a new category of trauma that's almost always much weaker and much more vague and talking about more trivial things? Well, there's reasons, there's an incentive. Once you start to look into it, you see that there are incentives here for this. So yeah, trauma has gone from being something that happens after months of being shelled in a muddy ditch to something that might be that you might get after your parents got divorced or something, which seems to me and a lot of people, I think, to be seriously trivializing the word. And it's now been hijacked by mental health professionals to describe virtually anything that their patients or clients find upsetting, basically. So Maté, to be fair, he does differentiate between capital T traumas or small t traumas. And he was talking about that in this article. He said, where is it? There can be two types of wound, he says to the reporter. There's capital T traumatic events, which include things like being abused as a child and the loss of a parent. Then there are small t traumas. You can wound a kid not only by doing bad things to them, but by also not meeting their needs. Not really. I think most parents probably don't meet their kids' needs quite often, and I wouldn't call that wounding them. I'd call that being a human being and being really busy. And but this is the type of slightly icky fetishization of everything. Everybody's got to be wrapped in cotton wool. You know, this is the hallmark of Maté. So there's two junctures, there's two things here, two things to note here. Firstly, small t traumas, they don't really exist. They're not real. They don't exist in any psychiatric classification system whatsoever until recently, when the ICD-10, I think is the 10th edition of the ICD, which is one of the world's two psychiatric classification systems. So you have the DSM, which I think is currently on the 5th edition, and the ICD, which says on the 10th edition. And they, unwisely in my view, included this type of trauma as a new definition. They call it complex trauma. And it's highly bogus. And I'll do another video on that specifically. But for now, let's just say that we don't need small t traumas, complex trauma, small t traumas, for the simple reason that we already have a word for them, and that is upsetting things. That's what small t traumas are. And you don't need a psychiatric word for upsetting things for the simple reason that they don't cause mental illness. It's a universal experience which is quite normal. So what we're dealing with here with Maté and the movement that follows him is a pathologizing of everything and a fragilizing of everybody, an attempt to fragilize everybody by magnifying their pain and hurt, is creating a pain point that isn't really there. Why would they do that is the obvious question. Well, there's a reason, as we'll find out. So, I mean, secondly, to do that is to cast the net too wide, right? So, are we really supposed to believe that a parent can wound their child by not meeting their needs? It might be unfortunate. It might not even be good parenting, but I think wounding them is hyperbolic, right? But again, the more you hyperbolize things, the more you create a problem, the more you need somebody to solve that problem, and then steps in the great healer, right? So watching Maté, I've always thought, is a bit like, I mean, watching him therapize his quarry is a bit like watching a spiritualist medium work the room. You know, his leading questions, they're so vague and generic that eventually they've got to elicit an affirmative response in somebody. It's, you know, he'll sort of give a few opening salvos. He'll kind of feel around, and then you can see when he thinks he's got them, he'll throw out a volley of randomly assigned disorders, and then eventually kind of hammer you with a trauma diagnosis, or you've got ADHD, or it's kind of farcical to watch, and it is like watching a spiritualist medium or somebody just making stuff up on the spot. And again, there is no such thing. There is no such thing as a trauma diagnosis according to the trivial points that he will pick up in people's perfectly ordinary stories of their childhood. He'll say things like, "You're traumatized because your parents weren't there for you." What does that mean? Their unresolved trauma distracted them from meeting your needs. And then he kind of somatizes it as well. That's one of his other big things. It's all in the body. The trauma happens to you, and then it comes into your body and gets stuck in your body, kind of like a demon or something that then needs a hands-on healer to exorcise the demon. So it's, the pain is so overwhelming for you that your brain's shut down. You've got ADHD. It's really risible. And that's what the press were reacting to when they made such a fuss about what he'd done with Prince Harry. It was so unseemly. Okay, so I think ordinary people can see through this. I suppose the question is, why can't psychotherapists, and why can't huge sections of the helping professions? I've got an idea why, but we'll go into that later as well. So to go back to the real definition of trauma, which is perfectly usable, post-traumatic stress disorder. We've known about post-traumatic stress disorder since the Vietnam War. It was first, I think it was DSM-3, 1980, around then, when it first made the DSM, the diagnostic manual that all psychiatrists use. And the causes and symptoms were very, very clearly explained, and they're very distinct from the sort of vague mumbo-jumbo that Maté comes out with, that's perfectly normal experience. So the symptoms would be things like, as most people probably know, terrifying flashbacks, disorientation, hypervigilance. So a PTSD sufferer who's hypervigilant, I've run addiction treatment centers for decades. They're really, they're not mistakable. It's kind of closer to, I often think it's kind of closer to psychosis or schizophrenia or something like that, when you've got somebody who's got really heavy PTSD, because they're really jumpy and they're somewhat delusional at times. It's not like anxiety or feeling sad. It's really a seriously debilitating and noticeable and distinct psychological disorder. And the causes, again, were not up for debate. They weren't open to interpretation. They were things like suffering a near-death experience, being absolutely convinced I'm going to die now, or I'm going to be maimed, or I'm going to see such a thing happen to someone I love right now, and then you'd survive. But you're stuck with that horror, as it were. And we know that it kind of mangles your neuroanatomy. It has organic effect, right? So this, what would be called in psychiatry, this operationalization. So the disorder is clearly explained, defined, proven, researched, and it's proven to be very useful in clinical practice, very practical. PTSD is known as being one of the most well operationalized disorders in all of psychiatry. And the best person to read on that is a doctor called Michael Shearinger, who wrote 2 books. I think the first one was called They'll Never Be the Same, and the second one was called The Problem with Trauma. So he's another outspoken critic of this. And he's really experienced with PTSD. He's treated youth PTSD for decades and done a ton of research. And as he explains in those books, PTSD is a perfectly useful and adequate diagnosis. We didn't need a new one. So the fact that we've got a new one is somewhat suspect, right? So today, I'm traumatized in the sense that Gabor Maté means I'm upset, I'm hurt, I feel hurt. And that's a semantic shift which seems trivial, but it's not, right? The real world effects of that are anything but trivial, because if you can imagine, if everybody who's a bit hurt or upset also has access to services that veterans might need, and one of the big winners of that hard work that a psychiatric profession did, and I'm not a massive fan of the psychiatric profession, I've plenty to criticize that profession about, but their formation of PTSD was not one of that was one of their best moments, and veterans, one of the big winners of that, right? They got services, they got accepted for what was troubling them. It was discovered, it became more treatable, they got services. So if you're widening the definition to include almost anybody, then those services are going to be used by people who, frankly speaking, don't deserve them, right? So the real world effects of this semantic shift can be quite significant, right? So, you know, I've been watching Gabor Maté for some time. He's only just coming into most people's sort of view, but you know, I would beg to differ with the idea that relatively trivial upsets would cause organic disease or even addiction. Quite the opposite in the case of addiction, often, I would say. Oftentimes, I mean, I've worked in public sector and private sector in treatment centres, and it's true that street using populations, injection drug users living on the street, do have quite a high prevalence of coming from being brought up in care homes and things like that. But certainly, I think most people would agree, addiction is not limited to poor people. There's plenty of Hollywood actors and the children of wealthy people and increasing amounts of middle-class people who are addicted. And if anything, in the private treatment centre, I would say that a lot of people haven't been anywhere near something traumatic. Not even once in their life, and to some extent you might even say that a lack of adversity has been a factor in their becoming addicted. Is actually a lack of difficulties leaves them listless, bored. Life has no meaning because they don't have to fight at all, they don't have to do anything. So I mean, it's a kind of cliche that spoiled sons and daughters of Hollywood actors and politicians often get terrible addictions, right? So to state the bloody obvious, rates of childhood maltreatment are going down. They objectively are. So I looked this up. Actually, the Office of Juvenile Justice and Delinquency Prevention, that's the Department of Justice, I looked up their stats for the number of substantiated childhood abuse cases in the 90s, and it's gone down from an estimated 150,000 cases in 1992 to roughly half, about 80,000, 90,000 in 2000. So in other words, in the 1990s, substantiated cases of childhood abuse went down. To which people might say, well, those are only substantiated cases. No, substantiated cases, if anything, will go up through the decades because awareness is being raised. It's not the same as it was. Are we really supposed to believe that childhood abuse is less talked about, less understood, and less dealt with than it was in the 1950s? I don't think so. Social work departments have expanded. The police are much more on it. I mean, just look at the pummeling that the Catholic Church had through the 1990s and 2000s. No, the intervention, the discovery and intervention of childhood maltreatment of all kinds will absolutely be going up through the decades, through the 90s, 2000s, 2010s, not going down. So the fact that the substantiated cases were going down means that childhood maltreatment is going down. And that is probably to do with the incarceration of a lot of the offenders and social work interventions and all those things, right? But at the same time, the same cannot be said for substance abuse. So in that same time period, rates of substance abuse in the States and the UK and Western countries was going up, right? So to which the obvious point would be, well, the population's growing. But no, it's going up much more than the population's growing. So I looked at the Global Burden of Disease study, which was published in The Lancet in 2017. And substance abuse was responsible for about 12 million deaths globally, up from about 7 million in 1990. So that includes tobacco, of course, but most of the tobacco deaths were in the developing world. You know, those markets like China where people are smoking more and more and more as they develop. In the US and the UK, the main increase in drug deaths was caused by alcohol and illicit drugs like meth, fentanyl, cocaine, and other opioids. But here's the interesting thing. Not only did these drug deaths increase through the 1990s, much more than the population growth. There was actually a marked increase between 2000 and 2020. While the US population grew by, 25% in that period, alcohol deaths doubled and drug deaths went up 500%. So, and that's in every age group, but in particular, the 25 to 35-year-old age group, which is the generation who were children in the 1990s. So, you know, when every marker of childhood maltreatment was in decline. So if Maté's theories are correct, we would see less addiction in the 2010s and 2020s, and most especially in that age group. But we're not seeing that, we're seeing the complete opposite. So it's actually the inverse of what he said. Childhood trauma is going down and drug addiction is going up. So none of this seems to matter too much to Maté and his followers, though. They don't seem to care about the facts. This doesn't seem scientific, really, for them. This seems political. So if you take his new book, for example, its main, the myth of normal, its main thesis is that our culture is full of toxicities, whatever those are. Like he called them ignorance, inequality, environmental degradation, poverty. So you can see that he's politicized. He's politicizing mental health care. You know, he thinks that these political issues are central, and as if they were somehow unique to modernity. But the point is, most healthcare practitioners would be really wary of alluding to such politically charged issues, much less link them to chronic disease, right? So that's the kind of hubris here is odd, to say the least. But yeah, this is a guy who's convinced that trauma can be passed on intergenerationally, which is a sort of misuse of the concept of epigenetics that's so egregious, most scientists probably wouldn't even bother to debunk it, and yet he has got millions of credulous followers who, for the most part, are very well educated. So I don't think this is about the science or the facts. I think this is an emotional, political movement, right? Marxian healthcare meets the nether regions of Freudian psychobabble. So you kind of shudder to think by Maté's standards, how many people would really be walking around out there with trauma? It must be millions of them, you know, virtually everybody. So what do you do with this epidemic of hidden trauma? And that's a funny concept. I mean, in another video, I think I'm going to break down just how Freudian this idea is, because the idea of hidden trauma is one of Freud's central ideas. So this is just regurgitated Freud, really. And Freud died, you know, the best part of 100 years ago, never mind when he was writing. But this, what really rankles, I think, is the idea that this trauma is hidden from us plebs. You know, we need, so we unwittingly perpetuate it on our children. You know, we pass it down both biologically and unwittingly through our foibles because we're unaware, you know. And because we're ignorant, we need enlightened leaders like Maté to wake us, you know, to become woke, so we can wake up and see what he sees. So, which is just upselling, really. It's just like, I have the way. Funnily enough, the way involves buying books and going on ayahuasca retreats and things like that, that obviously you have to pay for, funnily enough. And that is, I wouldn't want to say all of psychology today, but it's an industry that other authors have famously described as manufacturing victims. And I'll dig into that in another video as well. So, and that's exactly what Maté did when he was therapizing our hapless lad, you know. The gullibility of the client is being used to further the agenda of the therapist. So here's to get to the nub of it with this article. How it ended was, or why it even began in the first place, was he got an absolute shellacking from the British press in particular. The ADHD Foundation tweeted, "It is neither ethical nor appropriate to tell someone for the first time in a public interview that they have ADHD." Quite so. But apparently, according to this article, Dr. Maté was quite shocked and surprised by this backlash. And he told the Guardian journalist it left him roiling inside with upset and even a certain amount of shame. Well, good, I suppose, because it was a bit tawdry, right? So did this elicit an apology? Not really. What could have been probably pretty quickly cleared up with an apology turned into quite a revealing insight into how the world's most famous trauma therapist is kind of ironically not very in touch with his feelings, right? Because he kind of explains to the reporter that he had to go and see a counsellor friend to talk it through because he was upset. But in that therapy session, he learned that the cause of his shame, as it were, was not this kind of fairly gargantuan error that he'd made. It was his own unresolved childhood trauma. I kid you not. And he kind of accused the press of not seeing him, or the real him, the mythical real him, which precipitated a traumatic response in him, as the journalist recounts. So she said, "Not feeling seen as a child seemed like a life-threatening situation to him after he was separated from his mother." That's where all this shame he was feeling comes from. It didn't come from what he did with Harry. It comes from his childhood and what happened to him, right? I mean, you can't make it up. And this encapsulates perfectly everything that's wrong with the modern trauma movement and how self-indulgent it is. And it's taken over the mental health establishment. It is the establishment. Like, it's not a fringe view. Me criticizing it is a fringe view. I mean, I will get heat. I have had heat for talking like this because it threatens the income and the philosophy and the belief system and the gravy train that is the trauma therapy movement. Okay, so they are the establishment. I am the maverick, and people like me. So I'd offer an alternative explanation of what was going on with Gabor's uneasy feelings. I'd suggest that what happened there was that he finally encountered the world of normal people, e.g. lowbrow print media, like The Sun or The Mirror or whoever it was. And that they, with people like that kind of neo-psychoanalytic woo-woo is not tolerated. And further, that his shame was, I'd say it was an adaptive response to the situation. Shame is adaptive. So in other words, it seeks to drive you towards a solution. Now here's the thing, that is not how trauma therapists see shame. They see shame as a useless social construct, a kind of stigma that's imposed on you by an oppressive society, something to be cast off, something that oppresses you and is unuseful. I don't think so. I think it's adaptive and quite useful. At this exact point, his feelings were trying to drive him towards a good outcome and to do what had to be done. But he didn't see it that way because of his self-obsessed, I'm traumatized, fragilizing belief system. Okay, so these dastardly feelings like shame, they might be unwelcome, but they emanate from the certain knowledge that you've screwed up big time, right? And they are seeking a corrective action. But for trauma therapists like Maté, this shame is a toxic emotion, okay? And something to be cast off, unwelcome stigma. And so what followed was this kind of ingenious ego-protecting escape route, which was to reframe the guilty feeling as a sign of his hidden trauma. Yeah, I mean, he couldn't make it up. So it all became about him. And that's my problem with trauma therapy, is in the world of addiction treatment, and when we're really trying to improve our mental health, and if we don't, there's serious consequences. One of the first things we learn that is really profitable is that I am the problem. I mean, my mentors used to jokingly say to me things like, you know, the only thing you need to know, Ali, is it's all your fault. And of course they were joking, but the general sentiment was that you have the agency to change. You know, you are responsible, really. Not for everything, but there's almost always a part that you've played. And what trauma therapy does is it completely destroys that and puts the agency on external institutions, other people. It's others that are the problem. It's society that's the problem. It's the modern world and its oppressiveness that's the problem. And that's what's causing you your trauma. But that's an impotent belief system, because until they change, you're buggered, really, which of course is untrue. We have more agency than that. So that's my big problem. And like all manifestations of this kind of developmentally obsessed Freudian thinking, Freud had a good side of his philosophy, I believe, which I'll go into more in other videos, which was his idea of the subconscious and the idea that 2/3 of the iceberg of our consciousness, as it were, is not available. That's an incredibly interesting idea and still hasn't been explained properly and is clearly incredibly important. But this kind of childhood obsessed side of Freud is, this is the problem with Freudian thinking, and the great allure of the modern trauma movement is its moral elasticity, right? So the way it validates our feelings, the way it helps us deny responsibility for the consequences of our actions by blaming them on the events of our childhood, is what it does essentially. And this willful immaturity in mental health professionals, this gullibility, this credulity is not acceptable in my view. But unfortunately, there's a growing market for teaching people how to become better psychological escape artists. So this is going to get a whole lot worse before it gets better.